Good evening, everyone. My name is HARSHA NAIR, and my presentation for today is COVID-19 guidelines for children and parents. Now, as we all know that the schools are reopening and there are chances of increase in the COVID-19 cases, it is our responsibility to educate children and parents about the do's and don't do's to stay away from the virus. So in this presentation, we will be discussing about what all things we have to do to be safe in this pandemic. So here we will discuss about what is COVID-19 virus and how it kills people. COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. The virus is transmitted through direct contact with respiratory droplets of an infected person and touching surfaces contaminated with the virus. The COVID-19 virus may survive on surfaces for several hours, but simple disinfectants can kill it. Symptoms can include fever, cough, and shortness of breath. And we still don't know many side effects or many consequences of having this virus in human body. Still, it's under research. So it's an unknown enemy to the mankind as of now. Even though it is a deadly virus, we can avoid the risk of infection with few simple hygienic behaviors. And when we adapt these behaviors in our day-to-day life, it's easier to fight with the virus. Wash your hands frequently using soap and water or an alcohol-based hand rub. Cover mouth and nose with flexed elbow or tissue when coughing or sneezing. Dispose of used tissue immediately. Avoid close contact with anyone who has cold or flu-like symptoms. Seek medical care early if you or your child have fever. Cough or difficulty breathing. Just call your doctor and take the appointment and just strictly follow the instruction of your medical practitioner. Before going to the doctor, call them first. Does COVID-19 affect children? This is a new virus and we do not know enough yet about how it affects children or pregnant women. We know it is possible for people of any age to be infected with the virus and children at increased risk of severe illness from COVID-19 as of the studies that we can see from the WHO. There are more COVID-19 cases reported among children with intellectual and developmental disabilities than those without. So it's our responsibility to keep our children safe in this pandemic. Keep children healthy. How do we do that? Teach and reinforce everyday preventive actions. Parents and caretakers play an important role in teaching children to wash their hands. Explain that hand washing can keep them healthy and stop the virus from spreading to others. Be a good role model. First, we have to follow the practices, then only our kids will follow us. If you wash your hands often, they are more likely to do the same. Make hand washing a family activity. Help your children to stay active. Encourage your child to play outdoors. It's great for physical and mental health. Take a walk with your child or go on a bike ride, but you should take all the safety measures before you go outside. Use indoor activity breaks like stretch breaks or dance breaks throughout the day to help your child stay healthy and focused. What should you do if your child has symptoms of COVID-19? Seek medical attention, continue to follow good hand and respiratory hygiene, keep your child up to date with vaccinations so that your child is protected against other viruses and bacteria causing diseases. If you or your child are having symptoms of COVID-19, just try to avoid going out to public places. and try to avoid contact with people who are having chronic diseases such as diabetics or um, cardiovascular diseases. 5 things parents should do before school reopening. Parents needs to put together a different back to school kit with masks, sanitizers, and other safety measures. Parents need to make sure all of their child's immunizations are up to date. Families need to prepare their children for a different school experience. If the family is able, they can help the schools with lunch and transportation. Parents should be prepared to support their children in remote learning if they are quarantined. Important things to consider when schools reopen. We have to review the school's plans to reduce risk for our children, and we have to maintain a healthy environment at home. Educate children about the need of social distancing and safety precautions. If not convinced with school's preparations, please opt for virtual at home learning feasibilities. Pay attention to academic and social emotional well being of the children. Limit time with people at highest risk of severe illness from COVID-19. If others in your home have an increased risk for severe illness from COVID-19, consider extra precautions to separate your child from those people. If you are unable to stay home with your child while school is out, carefully consider who might be best positioned to provide childcare. If someone at higher risk of COVID-19 will be providing care, limit your children's contact with other people. Consider postponing visits or trips to see older family members and grandparents. Connect virtually or by writing letters and sending through emails. Sometimes, as parents, we are not going to give much importance for factors that stress our children. We think they are children and they do not have any kind of stressors in their life, but that's wrong. So, in this COVID-19 pandemic, we have to help our children with stress management. How to help children coping with stress related to COVID-19. During an emergency, it is common and normal for you and your children to feel sad, nervous, upset, confused, afraid, or irritable. Encourage children to talk with someone they trust and may help to improve your mood. We have to follow a healthy lifestyle. If necessary, please contact medical practitioners or psychological consultants and avoid spreading misinformation to kids. Reduce the time to watch or listen to depressive media news. Spend more time with children and speak to them. Encourage them to interact with you and open up their feelings. Be kind, calm, and patient with your children's behaviors. Listen to your children's concerns. Acknowledge and validate their thoughts and feelings. Be honest, open, and supportive. Provide clear, factual information in a reassuring and age-appropriate way. Ask them how they are feeling. Let them know you are there for them. The support and care that we provide to them will help them to reduce their stress. Encourage positive behaviors. Children are much more likely to do what is asked if they are given positive instructions and praise for their efforts. So we have to appreciate for the good behavior that they are showing for a long time. Be a positive role model. Model healthy and positive behaviors as children learn almost everything by watching what other people do. So being a parent, we have to do positive role modeling for our children. Take steps to calm down before you react. Children may respond to stress and anxiety by acting out. They need you the most when they are misbehaving. Even if we see that our children are misbehaving to a particular situation, we have to calm down first, then we have to react on it in a better way and handle them well. There are some healthy meal and snack ideas during the COVID-19 pandemic. Healthy snack ideas. We have to try different snack combination with what you have at home, like vegetable plus fruit plus nuts or seeds, low fat yogurt, fruit, nuts or seeds, or low fat cheese, all grain crackers or English muffin, or vegetable or fruits. All these things can improve the immunity of our children. Choose healthy menu options. Drink water instead of ordering sugary drinks. Choose whole grain options such as whole grain pizza crust or bread. Choose options where half of the meal is vegetable and fruits. Ask for sauce and dressing on the side so you can control the amount. Choose foods cooked in healthier ways such as baked, grilled, broiled, or poached, and try to avoid the outside food as much as possible. Go back to home cooking. Social connectedness is very important for a child because it helps you stay connected and get social support. Help your child stay socially connected. Reach out to friends and family through phone or video chats. Write cards or letters to family members they may not be able to visit. Some schools and non-profits have resources for social and emotional learning. Check to see if your school has tips and guidelines to help support social and emotional needs of your child. Support your child. Parents can find more information about supporting their children during a COVID-19 outbreak on CDC's Helping Children Cope page. Talk with your child or teen about the COVID-19 outbreak. Answer questions and share facts about COVID-19 in a way that your child or teen can understand. Learn more about common reactions that children may have and how you can help children cope with the emergencies. We all know that it is difficult to keep children indoors for a long time. We can go out by following the safety guidelines. So there are some daily activities and going out information. What you need to know. In general, the more closely you interact with others and the longer that interaction, the higher risk of COVID-19 spread is there. If you decide to engage in public activities, continue to protect yourself by practicing everyday preventive actions. Keep these items on hand when venturing out. A face mask, tissues, and a hand sanitizer with at least 60% of alcohol in it, if possible. These things will ensure that you are safe outside. It's not only about taking care of children, but also about the parents. We have to take care of ourselves. Then only we can take care of our children in a better way. Self-care is important. Even if it is not a pandemic, self-care is really important for everyone. But during this pandemic, it's more important. Parents and caregivers take better care of their children when they take care of themselves too. Eat well, get enough rest, take breaks, and do something fun or relaxing. Be kind to yourself. Connect virtually with others. You are not alone. Find support and release stress by talking about your feelings and concerns with your friends and family. Recompose yourself. Practice a 1 minute mindfulness activity. Notice your thoughts. Notice how you feel emotionally. Notice if your feelings are happy or not. Notice how your body feels and notice anything that hurt or is tense. This will help you to relax and feel grounded. And if you're thinking that meditation or yoga can help you to relax, please do that. If you are in crisis, what should you do? If you are in immediate danger or need urgent medical support, call 911. If you are experiencing gender-based violence, you can access a crisis line in your province or territory. You may also access support workers, social workers, psychologists, and other professionals for confidential chat sessions or phone calls by texting wellness to 686868 for youth, 74171 for adults. I hope these informations and guidelines will help you to be safe and healthy during the COVID-19 crisis. Stay healthy and safe. Thank you for listening.